This bill did not do so. What does it do? Well, one thing it does is it takes power away from patients and it turns it over to the federal government. Now, it's going to sound like rhetoric, so let me elaborate. Again, as a physician who's worked for 20 years with the uninsured, I've learned that when you put the patient in the middle of the process, if you say the most important person here is the patient, then actually you tend to lower cost and have healthier patients. If you think about it, that program, which lowers someone's premiums 20% if she participates in a wellness program, it puts the responsibility for someone's health on the person with the greatest ability to make a change. That is the patient. If she is financially rewarded, if she's financially rewarded for having a healthier lifestyle, as it turns out, she'll have a healthier lifestyle. We as a society, not only will she be healthier, she will have lower cost, and frankly, those lower costs among millions of patients, if you will, lowers the cost for the system. There's one way to explain this. There's something in the Republican proposals called health savings accounts. Now, in a health savings account, you put the patient in the middle of the process in the following fashion. A health savings account takes the money that a family would normally spend for a health care premium, it sluices off a portion of it and puts it into a bank account. So if with a traditional insurance policy, at the beginning of the year, a family of four puts up $12,000, if at the end of the year they've not seen a doctor, well, they put up another $12,000 for the next year. At the end of the year, they put up another $12,000, and every year they put up another $12,000. In a health savings account, you sluice off a portion and you put it into an account. Now, that money comes from the money you would ordinarily be spending for a premium. But instead of spending it for a premium, you put it in this bank account. And instead of asking the insurance company to pay for a flu shot, you pay for it out of your bank account. Instead of asking for the insurance company to pay for your arthritis medicine, you'd pay for it out of your bank account. The advantage is, at the end of the year, if you have money left over, instead of losing it, it rolls over until the next year. Or, if you have a family member whose costs are excessive, you can donate portions of your health savings account to your family member. And so with that money, it is money that you are incentivized to spend wisely. I'll give you an example. Two patients I'll come to mind, or three patients. There's one patient who's got a traditional insurance policy, and a very nice woman. And she's got an expensive policy, but she's a woman of means, and she can afford it. And she says, I never look at the bill. If the doctor writes me a generic or a name brand drug, I don't care. My insurance pays for it. When I get a bill from the hospital, I don't look at it. The insurance pays for it. And so because the insurance pays for everything, she likes her insurance policy, but she's got the money to pay for it. Contrast that with someone like the gentleman I'm about to describe. We're talking about health savings accounts. He goes, I have a health savings account. I went to my doctor, and my doctor wrote me a prescription for a medicine that I knew by experience would cost $159. Now notice, he didn't say $160, he said $159, because he's paying for this out of his account. And he said, my doctor wrote me for this medicine for $159. I said, Doc, I have a health savings account. Do you mind writing me for something cheaper? And the physician said, oh, I'm sorry, you have an HSA. And he tore up that prescription and he wrote him for a generic. Now you can say, why didn't the doctor write for the generic in the first place? Well, he probably should have. On the other hand, who is most responsible for an individual's health? The person most responsible for an individual's health is that individual. And so just like if I were to go to Target or Walmart and say, okay, I'm going to buy school uniforms for my children, it's really not Target's responsibility to prove to me that they are cheaper than Walmart. It's my responsibility to see who's cheaper and then to go and to the place that gives me the best value for my money. So it puts the responsibility where probably it most rightfully should be. And frankly, with that responsibility, the man responded. Instead of getting a medicine that cost $159, he got a medicine that cost $20. The system saved $139. The system saved $139. If you multiply that across the millions of transactions, then the system saves millions and even billions of dollars. Now,